Hello.
All right. Hello,
Welcome,
hello.
everybody. Thanks for tuning in. Uh, we're in a new station, new digs. Want to thank Etymology and Believe Radio for making this possible. I want to make the
Mr. Curtis Thomas.
and Mr. Thomas for letting me in and support and just all the things we need to do. It takes a village sometimes to make things happen.
All the time. You're absolutely right.
And want to thank my co-host, Ms.Barbara Howard, who is the proponent of Eyes as a Conscious Soul, and under which I broadcast the show Education is the Best Medicine. I want to thank her for her support and just being here. Um, been a really interesting week, challenging. Understand.
Very much so. Just a second ago, too.
Uh,
Challenging with getting everything in order.
yeah, we have to
Try to
learn.
be busy, but that's okay. God is good.
Africans have to burn and learn.
There we go.
And so, while we're getting set up, I want to talk a little bit about. First of all, thank everyone for tuning in. My Facebook family, as we start to prepare for this transition, I want to thank them and thank them for being available. Today was again, these shows are collaborative, and what had happened was I was originally going to do this show on public health, and we'll define that too. But interesting enough, a story came about because this month is Mental Health Month. I want to also thank Miss Gigi Crowder and hope she's doing well. And Miss Carolyn Crawford, who we're going to have on the show at one point, talking about healthcare systems and they need for a African American comprehensive healthcare center slash the mouths say that patient-centered homes are best, so we would probably do better in a clinical environment that has us seeing not only the mental health but the physical health in the same site. And we want this particular clinic to have an African-centric focus, unlike other general clinics. That being said, Miss Howard and I were talking, and she mentioned the death of a young man, 19. And it kind of struck me as a discussion around how we can interface public health with mental health. And what I want to do is take us through the public health system, and because it's been very challenging, and COVID made it very challenging. And we are now left with a number of issues, the great resignations, and that's to include healthcare providers and clinicians that are no longer coming back to practice because of the stressors. And if you read a National Medical Association, which is the African American component uh, of the of that kind of literature, it says that the physician at that time and the providers at that time have just lost the joy.
Before you get started, we
Yes.
want to just say to the audience, thank you for tuning in to Believe Radio. See, Mr. Pearson is on point. He's ready to go to give you guys the medicine hour and to give you the information that we need for our community. But before we go there,
A word from our sponsors.
It's family up in here. We're so grateful and thankful again for Believe Radio, which is a 24-hour gospel and music station. The Eyes of the Conscious Soul with Sister B. Mello brings to you every first Saturday of the month. We have the Cafe Le Bleu Lounge, where there are 15 to 45-minute segments called The Corner. Each corner has a blueprint, and that is unique of its own. So we also always want you to relax and vibe out to cool sounds, fireside chats, and be inspired by affirmations and inspirational messages. The first corner is the artist talk. Second corner is why I dream. The third corner, she who believes takes off the mask. Every second Saturday of the month from 2 p.m. to 3 p.m., we have the medicine hour. Mr. George Pearson, a physician assistant, and I am his co host, Sister B. Mello. This is where we believe building a better tomorrow starts with us. Topics we cover: health issues and concerns, healthy eating habits, education, financing, and politics in the African American community. We believe taking care of our temple, mind, and spirit is essential to having mental health, healthy eating habits, and knowing that healthy thinking leads to a healthy way of living. Every third Saturday of the month from 2 p.m. to 3 p.m., we have Education is the Best Medicine. And then the fourth Saturday of the month, we have the kitchen table. Mr. Pearson, again, we are acknowledging that May is Mental Health Wellness Month. So we just want to again bring you a show that's highlighting our mental, our mental. How do we inspire each other? How do we inspire ourselves? And what do we need to do in order to stay healthy mentally? Go ahead, Mr. Pearson. And the name of the show again is called
Education is the best medicine.
Not that one. That's your show. That's next Saturday, but it's the medicine hour. But I'm saying
Okay.
the show tonight
Oh,
is highlighting.
so we are highlighting public health, uh, mental health,
Mm-hmm.
and their intersection.
Okay.
And I want you to tell the story and bring me up to date because we had talked about this, and I thought it was a great way to intersect and put this lost young man who we've lost, and again we've lost another young man to this case suicide. And first of all, this is not a medical program. Any
Exactly.
information that we give is always informational, and then we always ask you go to your mental or medical health provider or both in terms of asking and understanding the issues and diagnosis and treatment, those kinds of things.
So I
Uh,
won't share the last name of the young man, but I would just say lift his name, and Miss Gigi Crowder always shares with us is to lift the name of the people that have suffered from mental health illness, and for the ones that's not here with us today that has transitioned to the other side. And his name is Mr. Jeremiah. The work that I do at NAMI CC is I am the outreach coordinator for the Uplift program, and we provide information, education, and resources and groups to African American communities, Black folks, African American people with African descent. So we are here at NAMI CC is to uplift the African American community, making sure that we get the resources and the information that we need, because we know the stigma, we know how important it is to make sure us as a people, culturally sensitive information and working in that kind of environment is important, and it's non-clinical but with lived experience, and that is, you can pull up the website NAMI CC. So yeah, I just want to say, just keep the young man in
and
mind.
for those that are contemplating suicide, I want
Yes.
to put out the National Suicide
Mm.
Lifeline. The number is 80273-8255. And I'm going to circle around because, I always like to give the solution before we talk about the answer.
Absolutely, which is
And
important.
so, in suicide prevention strategies, uh, the strategy is to strengthen economic support, and that includes household financial security and housing stabilization. All these things tend to play a role in suicide.
Hmm.
Strengthen access and delivery of suicide care, and that means more coverage for mental health conditions and health insurance. Reduce provider shortages in underserved areas. And we're going to talk about that too.
Yeah,
Safer.
and that's why the outreach is important.
That's why the voice and safer suicide care. And I also want to mention stigma.
Mm-hmm.
Very, very important.
Mm-hmm.
We need to understand that in our communities, stigma is a real um, fire point to getting care, to acknowledgement, to having discussion. Because when I put this young man in the circle,
Yeah.
the public health model says, how could we have prevented this? And we're going to talk
Mm-hmm.
about that. Create protective environments, again, safe environments for people, men, women, transgender, LBGT, undecided, can talk about their issues in terms um, um, of the concerns around um, why would they commit suicide? How would they commit suicide? These things need to be talked about. We want to reduce the lethal means and access. And we've had an early discussion about the use of handguns. A majority of the suicides in the community at large are used with handguns or a handgun is involved.
Mm-hmm.
And now we have the a ghost gun. So here's another layer
My
of
goodness.
gun
In our
access. And
communities.
we
Yeah.
just had a recent ruling that says that 19-year-olds can have under 18 can have guns.
Excuse me?
Yeah,
Can you say that again?
there was a
When was this?
ruling last week or so
Oh
that
my goodness.
stated that there was a law that in California that kids 18 or under could not own guns. Well, that's been kicked out, so we'll see how that
My.
goes. But again, access to guns,
Yeah.
the glorification of guns. How about that?
Absolutely. Yeah.
And also create organizational policies and cultures around reduction of lethal means. Community-based policies reduce excessive. We know drugs and alcohol play a
Mm-hmm.
role in
Mm-hmm.
suicide.
Mm-hmm. Mm-hmm.
Um, and we want to promote connectedness, peer normal programs. If this young man had
Yeah.
a person he could go to or a group of people, and
Which he did. But
yeah,
see, that's the thing.
hmm,
We never know what a person is going through, just like they were saying the model. It seems like everything, she was on top of the world and the whole nine. But her mom, I believe, had said that she suffered from depression.
yeah,
But you
and a,
never
and a couple of
know.
young athletes. We expect a couple over Stanford female athletes to commit suicide.
My
But this
goodness.
is a discussion around, back to systems and
Hmm.
accessibility, and do you think you have enough to talk to somebody without being stigmatized?
Absolutely.
And now you want to, so in some of the training, want to identify people at risk, gatekeeper training, crisis intervention, treatment of people at risk for suicide. Um, and we want to lessen the harms and prevent future risk strategy, preventing suicide post prevention, safe reporting, messaging about suicide. Again, the number that I want to have folks call if they're feeling that way, it's online and Lifeline Crisis Chat, the National Suicide Prevention Lifeline. The telephone number again is 1-800 273 8255.
And then we also definitely want you to this one, it says it's a national suicide prevention out lifeline, and that one was 8.
00273
That's it.
8255. This is CDC,
Okay, and then they can also pull up NAMI
right?
CC
Please.
information. Go to the website and you can pull that up. And then also on Keith Carson,
Mhm.
Supervisor Keith Carson's site, there are a lot of information which I have pulled up that they can go to too, as on a local tip right here
Yeah.
close to you if you're living in this particular area. Go ahead, sir.
So per our pre-production meeting, we started to have a discussion because this is Mental Health Month,
Mm-hmm.
and and I want to do an intersection between public health and again the suicide of this young man, 19, young black man. Um,
Before you go there, can I share this information? It
please.
says May is Mental Health Month, a time to talk openly and remove the stigma from mental health issues, as well as time to remind us all that as important as it is to eat and be well and exercise and go to a physician regularly, it is just as important for us to take care of our mental and emotional well-being. And excuse me, and if you are feeling overwhelmed, stress, anxiety, or having thoughts about self harm, there are many resources available in our community from county services and local organizations, just as NAMI CC. Um, Early in this year, okay, thank you. I wanted to share that
No, no
actual
doubt.
information just to give them,
So maybe you
again,
can make
sharing
me
what you
aware
said.
because it'll help us kind of formulate our talk. Do we know how he passed?
No, we don't.
Okay.
No, we don't.
You know.
But just as of right now, we know that he was a bright young man
Mhm.
coming from school. Uh, just I was on a Zoom with him,
Mhm.
earlier part of the week, and he was radiant. He was a very intelligent young man,
Mhm.
and I pray for him
So
and the family
I think some of the specifics that I
and
understood,
our NAMCC staff.
yeah, and again, the trauma from the staff, the trauma that
Absolutely.
people have to deal with, the trauma you deal with, because if you just recently talked to him and now he's gone.
Hmm.
I guess, am I? I'm not sure, but my understanding that he had read a media post, and this kind of changed his mindset about what was going on.
Well, just as
And
well as all as
yeah,
I wouldn't say just him looking at a media post. I would just say us in general, how toxic media
yeah,
can play a role in our lives,
mhm,
and is important for us to make sure that we seek, you
help,
know, seek help,
yeah.
because social
But we
media
have to
is a
seek, yeah,
beast.
we have to seek the right kind of help, and that's
Absolutely.
one of the things that I have to layer in this conversation is that you know it just can't be anybody anymore. It because we understand that when clinicians look like us and come from our same communities and have lived some of our shared experience, they're more likely and more better to affect and address our mental health issue, our mental illness and issues.
So you always say, Dr. Jakur always say about
Dr.
cultural,
Churi,
yeah,
yeah,
cultural,
competence and
yes,
cultural,
and
and
Dr. Dante
you know,
King too.
definitely. And so, my thought was to provide
Dr.
a,
Dante King,
my
yes,
thought was to provide a person-centered approach uh, to the loss of this young black man and men like him, and
yes,
not
and young
to
women too.
and right, and not to negate
Oh yeah,
women, not to negate
I know you
the
didn't.
victim, but but to say that it's always that we need to understand the uniqueness of these kinds of traumas and how they have affected even a young man in the bloom of his life. Um, I would say that again, my discussion was to examine public health as it intersects, and how this starts is how could have public health intervened in the prevention of his death, and I
And
think
many others.
and many I think it goes deeper than that. I'm going to just kind of keep people up to date. So let's define health, and it was the original from the World Health Organization in 1978 in Russia, no doubt, the Malta International Conference of Primary Care, and it stated that health, which is a com- it, health is a complete physical is not just a complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. It is a fundamental human right that the attainment is the highest possible level of health it's the most important worldwide social goal whose if you can realize it requires the action of many other social and economic sectors in addition to health sector. So what we're saying now that health isn't just you going to see a provider, it's your environment, it's your community, it's food, clothing, shelter, or social determinants, and we'll talk about those. But the bottom line is that public health, and it comes into the distinction of clinical medicine. Example, this young man, um, he had he possibly could have seen a provider a month before he hurt himself. I mean, before he committed suicide. It's not uncommon when people commit suicide having seen a provider even 2 weeks to a month, or talk to people that he could have talked to and told about how he was feeling. But for some reason, he stayed silent. And again, we talk about the stigma. We talk about a young black man trying to handle emotions, or a young person in these times trying to handle emotions
Right.
that are kind of adult in nature.
Because we
So
don't know if
right,
he spoke with someone or what. We
right,
know nothing about what actually happened. However, he's not here with us anymore, and we all are mourning another African American black male that's in our community that's not here with us.
And I mean that's and just in general, we understand that mental illness, and particularly in California, people do not receive treatment. More than 60% of adults with mental illness and 40% of those with a serious illness do not receive outpatient care or do not receive outpatient care. In other words, they go to the hospital, they get seen, and they get discharged. And I have a story of an African American man who was my good friend who developed schizophrenia, and he somehow the county spent almost $2 million on him before he died.
Wow.
So you think you could take
Prevention is
$500,000 that and just dealt with his mental issue, and then the medical
that's
issue
why
will
we
fall.
need funds.
Wow.
We need funds to go the into the field for mental health
They
services.
can't be like it's been before, where
Absolutely.
you get the money and then you don't do
Yes.
the work.
Absolutely.
So this is what has to stop: the lack of care in the care. So we can go to a system, but if that system does not care about us, does not consider us of value, I think us we are important, we tend not only not to go to the care, we shun it.
Mhm.
So that's what happens in mental health also. So this is a medical issue, and it's a mental health issue, and it's a public health issue.
Mhm. And we
You
need
know,
to not separate it.
you need not to separate
We
it.
need
Right.
not, and
Right.
that's the reason why we're sharing the information here on the Medicine Hour, is that we public health services, it can't be the city and then the public health. You all need to come together and see how we can get this thing done for our community. I've
And,
heard
and
many
and
stories.
when you say that, I mean, let me be specific. I'm talking about Africans in America that were born who are descendants of slaves of 1619,
Okay.
because that is essentially the group that has more issue. Now, I'm talking over a 30-year period of me and my career. We were when I first started, when I first got I'm in a class at Stanford, and we're number one hypertension, number one diabetes,
My
number
goodness.
one in everything. And guess what? We still are number one.
Yeah.
So
Something's not working.
There you go.
Something's not working.
Something's not working.
We're pouring money into a bag that has
Is
a hole
public
in it.
health really
We need
public?
to revamp it. Yeah,
Again, so
revision. We need to our council members, to the ones that can make the laws. We're beseeching you today that it's not working. We need to find a way to make this really work for our
and
communities
part of that now is that
and our families,
that health
in our communities.
health is social determinants.
And before you go there,
yes,
I just want to say this is a very, very heavy topic. So please, if you need to take a break from listening, if you need to get water, if you need to walk around, please do so, because we're saying wellness is the key. Our mental breathing. You were telling us about the breathing, just
taking a deep breath. So and a lot of the mental health issues, they're moving away from just medicine, because it doesn't work that way. People need strategies to calm themselves, to identify the whatever that fear is. And if it's a real fear, like you're about to get run over by a car, then that's a reason to be anxious. But I would have to say that if you see a car 5 blocks down the street and you have a green light and you're walking, I don't know if you need to be anxious or not. But people with true anxiety disorders are anxious about that.
Wow.
So part of this discussion is around using breathing techniques, relaxation techniques, things like behavioral activation, where you minimize the bad things and emphasize the good things. And that's one of the things that's going on in terms of self-care. Now, self-care is a you can go on the internet and see 50 million for self-care,
right?
but that ain't what this is. It's about your mental health. And so I think that, again, some of the social determinants we talk about are the conditions and environments where people are born, live, work, play, worship, and age. There's a really interesting piece about a few years back and they're still doing it now, that you can look at a person's zip code in Oakland and
See how long
know
the life expectancy.
their life expectancy.
Yeah.
That is still true,
Hmm.
you know. And one of the things that I found about in doing the research for the show is that um, loneliness is an issue.
Yeah.
And I say back to this public health model, uh,
And COVID played a
and
really
it
major role
oh
in
it
loneliness.
changed our
The
whole, well,
whole.
I'll put it like this: it exposed
There we
the
go.
problems in the system.
Absolutely. That's what
You
I would
know,
say.
yeah.
Yeah.
So we are now at a point now where it's crisis to
Yes.
me, because we're losing a lot of quality providers. They're retiring. I spoke with 5 physicians over my career
My
who have
goodness.
recently retired in the last year and no longer will practice. So again, the joy in medicine is gone. You know, so we now we have a discussion with a an escalating disease burden from these mental health issues. We have a lack of quality providers. 83% of the providers are white, 5% are black, and indigenous, I think, is 0.5.
Goodness. And that must change.
So, well, and but again, we don't put the people in medical school. We don't help them get through school. We don't give them a place to practice. Here's the discussion.
But we'll build jails.
But yeah,
We'll stick them in jails.
send,
And then we have
send money
some
for
that's in,
war.
right. And absolutely, we'll have someone in crisis, but they'll send them to jail. Like my nephew,
Yeah.
you know, he's experiencing mental health, but
Here's the discussion. This is, and I'll say it publicly, this is an economic discussion.
Mhm.
This is not even about health.
Mhm.
You want to spend $2 million on one person and then they still die? Do you want to have 25% of a group of people with mental health issues in jail, or homeless, or
Yeah.
both? And if you go to LA, they're
Mm,
homeless, they get addicted to drugs, and then they die.
my goodness.
More of a cost to the system. So I think this is not only just a discussion around uh, poor care,
Mhm.
it's a discussion around cost.
Mhm.
And that's what's driving.
And
a
that
lot
should
of
be
this
the
now.
focus.
That's what it is. That's what it is. So when we talk about social determinants, you can group it into 5 domains: economic stability, education, healthcare, access and quality, neighborhood built environments, social and community context, which is different than in general issues. Medicine was considered an individual issue. It was your individual responsibility. The clinician worked to take care of that mental issue or that broken leg.
Mhm.
But because of the schism between general medicine and public health, we lost the ability to not only we could treat somebody, but the prevention issues and for this not happening again, never. So it became a cycle. This person kept coming back to the system, mental health, kept coming. They call them yo-yos, you know, frequent flyers, you know.
What?
Yeah. So, um, and I just in defining public health, it's the art and science of preventing disease, prolonging life, and promoting health through the organized efforts of society, not just the individual, but the society.
My goodness.
We've gotten this wrong. This is who in 1988, and we're still treating people like individuals. It's your responsibility whether you are healthy, whether you can work, whether you get COVID, your responsibility, not true.
Yeah.
And so the responsibility goes with a society, because the health of the society is the health of the country. And we miss that. There was one, they had like, there was a group of like 5 social determined 12. So I took the 5 and the 12, and the discussion around safe housing, transportation, neighborhoods. Now understand, this is mental health. This is mental health. I have had patients discharged diabetic, bipolar schizophrenic, and stabilized them, but they went back to a homeless situation. So quite naturally, they decompensate. And this is the revolving wheel. You know how
Yeah.
much money people make when those folks continue to roll through the system.
They put the sheriffs, the jailers, the what is it, the guards.
Right.
There are several people that have a job.
Yeah. Well, I mean,
because of them
so
being in there.
understand. So let's take it this way. When that young man
Yeah.
died, he was probably evac to the ER. They tried to resuscitate
Oh,
him. And so they say from the point this happens to the point he is declared dead, 25 people touch him.
my.
And they ain't free.
Right.
So the discussion around this is this poor young black man, is an economic unit for a system.
And I definitely want to share. There are several groups that if you're in the NAMI, if you're in Contra Costa area, you can definitely call NAMI. You can link up to the family group. There are a several groups there. We have a men's group that's facilitated by Mr. Eddie Morris. That's every second and fourth Saturday of the month from 1 to 2 p.m. They
Do you
missed it
guys are you
today.
guys writing this stuff down? Come on,
Yeah.
let's get it right now. Come on.
Then
You're not gonna. First of all, you're not gonna hear this about
no.
health.
Well, so
And wellness. You're gonna hear it about after the issue has happened.
absolutely.
So let's be preventative.
And then we have the African American Support Group, facilitated by Miss Gigi Crowder. That's every fourth Wednesday from 7 p.m. to 8 p.m. The telephone number is 510-990-2670. And then we have a Men of Wellness and Men of Faith Support that happens every second and fourth Wednesday at 7 p.m. And the telephone number there to contact the individuals to connect with them are 925-765-8045. And that's Mr. Eddie Morris or Mr. Alonzo Edwards, Pastor Edwards.
If
And
you
it's,
just tuned in, you're listening to Believe Radio. Thank you for tuning in. This is Isaac Conscious Soul with the Medicine Hour. Barbara, can you tell us the lineup again, please?
of course, I just want to finish sharing this information
Sure.
right here, and then we can. So, if you go to NAMI CC website, you will be able to see the groups that we have, and definitely make sure that you contact them for the African American Uplift Program, which provides services, resources, support groups, and to our African American community. And again, you have tuned in to Believe Radio on the Eyes of the Conscious Soul with your Sister B. Mello, every first Saturday of the month from 2 p.m. to 3 p.m. We have the Cafe Le Blue Lounge, which we have the Artist Talk, Why I Dream. The Corner is she who takes off the mask, she who believes takes off the mask. And every second Saturday of the month, we have the Medicine Hour with my co-host, Mr. George Pearson. This is where we believe building a better tomorrow starts with us. Topics we cover, as you hear us today, is health issues and concerns, healthy eating habits. We talk about education, financing, and politics in the African American community. We believe taking care of our temple, mind, and spirit is essential to mental wellness, healthy eating, and having a healthy way of thinking leads to a healthy way of living. And on the third Saturday, we have the education is the best medicine. Fourth Saturday, the kitchen table. Again, today you have tuned in to Believe Radio, which is a 24-hour inspirational and gospel music station. Please tell all family members and friends and your network to tune in to us weekly. There are several programs that's here that's beneficial to our communities. So please, again, tune in to Believe Radio. And today you're listening to the Medicine Hour. Go ahead, Mr. Pearson.
So I just wanted to make sure we understand that, mental health, our physical health now have to have support.
Absolutely.
And one of the discussions that we have to have is this discussion around social determinants. And again, some of the domains of economic stability, education, access and quality, healthcare access and quality, neighborhood and built environments, social and community context in that environment. Now that is from the CDC.
Mm.
They had one that had 12 determinants, and I thought they were kind of interesting, so I included them. And it said safe housing, transportation in neighborhoods, racism, discrimination, and violence, education, job opportunities and income, access to nutritious foods and physical activity opportunity. You think you keep talking about
Hmm.
polluted air and water, language and literary skills. So in one, they discuss racism as a context for a social determinant in the CDC guideline. You got to look for that, but it probably doesn't mention it. And we haven't even defined mental health. And what is the full meaning of mental health? Mental health refers to the thinking process, the behavioral and emotional well-being. They use a big word called cognitive. So cognitive thinking, I just said thinking process. Behavioral and emotional well-being is all about how people think, feel, and behave. People sometimes use this term mental health to mean the absence of mental disorder. Mental health can affect daily living, relationships, and physical health. So the discussion around mental health is the ability to function in all those parameters, not just the absence of a depression or anxiety. So that's the crux of this now, is that we need to understand our mental health and our physical health make for a healthy human being.
Absolutely. It's not separate. It's
It's not separate, exactly.
mind, body, soul, and spirit,
You know,
all
and
parts.
I wanted to kind of bring this to a point and say, I recently listened to a recent talk by Patrick Remington entitled "The Schism," and schism is defined as the split or division between strongly opposed sections or parties caused by differences in opinions or belief. Schism is about 100 years old between general medicine and public health. In the
And you've
18
been practicing for how many years?
35 years.
35
Yeah,
years.
and
Don't say like, oh, it's 35 years. That's a pat on the back. In our communities, we want to thank you, Mr. Pearson, for the work that you do
It
and
ain't
you've done.
easy.
I know it
It
ain't
ain't
easy.
easy.
We know it ain't
No.
easy.
And I think too is that here is a
And
discussion.
humor.
Yeah,
Excuse me, folks.
gotta be
We
funny.
are about having fun. We know how to be
Hmm.
serious. But I was told, Gigi said, well, I think it was just the other day, it takes more to use your face and give a smile than
Then
it
there's
is
the
to frown.
frown.
And
Yeah,
so,
definitely.
that those, what is it? What is it?
Endorphins.
Endorphins.
Yeah.
Yeah. So
So
healthy ways of doing things.
got it. So this kind of schism wasn't didn't always exist between general medicine and public health. It was in the late 1800s. They were working together, but what they did in the late 1800s, they modified this medical school curriculum to include 2 years of science and then 2 years of clinical. Understand the closings too were of African American medical schools.
Come on.
So understand that this has been a discussion, because I'm sure if you went to Africans in 1800 and said, "Do you want a medical school closed?" They would have told you, "Heck no." But they closed them.
My.
And so that is why we have only 5% of physicians, because the historically black colleges ran medical schools, but they were never certified and qualified
And
by the system. They have since then rejected that, but in the times it was a way of limiting the number and access again. So here we are in the 1800s, post-slavery, not even to be able to get doctors that want to take care of us. So if our doctors didn't take care of us, and we weren't being let into the hospitals that said
we
all
don't.
white,
Yeah.
then you were dying.
You die.
And
Yeah.
here's the issue. Here's the second issue. I'm not going to go someplace where I know they may kill me.
Absolutely. That's why
Yeah.
there's been an issue with the vaccine, with
Stigma.
COVID-19, the stigma.
Mental health. Hey, understand in Asia,
Mm-hmm.
it just ain't us.
Mm-hmm.
The old Asians are not taking the vaccine because they don't trust Western medicine.
Wow.
So what you see in China, oh, by the way, we're going to go on a side, but say that COVID is not over yet.
No, it's not.
We have
And people are acting
we
like
have a
it's over.
BVA2 variant that is going to, I don't know, people don't understand that this is almost the difference between this and the flu epidemic with swine flu is the fact that when you get flu, it doesn't hang on and change your mentality and have you being tired and that kind of thing. Once you got the flu, it was over. COVID can produce long hauler syndrome. This is why we don't want the kids to get it. Imagine a 5 or 6 year old having to deal with this in his late 20s.
No.
That's why and here's the cavalier issue. The kids from zero to 4 have still not been vaccinated yet. They vaccinated the older adults. Why? Because of immunity. That's why they got the vaccines first. Now, why aren't we doing that to our children? Because they don't have a mature immune system now. We're going to see it. I guarantee you. Remember, I said that. Watch September, October, November, December. Because they're all getting ready to go back to school, and 30% of America still is not vaccinated.
Mm.
And their kids aren't vaccinated. So, what is that going to create? Well, if you believe in the science, you understand there's going to be, if you watch China, if you watch the Asian companies reintroducing. So you want to get locked down again because that's what they're doing in China.
Wow. And that's real.
And what has happened? Well, the supply chains, the things that we were getting from all these communities no longer exist. Watch your iPod. It was $50 when they created it. Now it's going to be about, and now you pay $2,000 for it, and now you can't get the part. So think about this as we talk about health and healthy and wellness. Yes.
To share, I wanted to say also at NAMI CC, we have the CARE Cal Hope support groups. So you can tune in, excuse me, and go on the website. You'll find a faith-focused grief support group. And that was facilitated by Minister Desi Russian. You can contact her. That's every second Friday of the month from 6:30 p.m. to 7:30 p.m. And then you have Living with Purpose support group. So you can, as basically, I'm just trying to give you information that you can go on. There is a TAY group that you can tap into. There is an API group. At NAMI CC is uniquely designed, and we have array of people with lived experience can support you. So again, please go on the NAMI CC website and check out the services that we provide, because we are about advocating, supporting, and educating individuals. Thank you, sir.
So the schism that was created in medicine versus public health had, as we see today, medical schools on the campuses and now public health schools on the campuses. Now, the reason why there was an issue is because the current medical curriculum did not account for the public health aspect of it. And it was treated separately. So all because of money, because of competing resources for limited resources, and what's really wasn't included is the study of epidemiology, which is a noun, and that is the scientific, systematic, and data-driven discussions around the distribution, frequency, patterns of the determinants, the risk factors, and how to deal with them in terms of health-related issues and events, not just diseases. So in other words, epidemiology looks at the pattern of diseases and try to prevent. A primary example is sanitation. Once we just started, we get a plumbing system in the Americas that had proper water. We see that as preventing disease. But if you go to Flint, Michigan, and they change your water source, then you get lead. So one of the primary issues was
it's always said was done in the dark to come to the light.
When a society is not reflective of addressing the needs of the entire community, that community suffers.
Absolutely.
And so so that was the piece that's been missing in medicine, to look at a holistic approach to health care and mental care that includes the individual and the community. The social determinants. All those things need to be in place in order to have mental health as well as physical health.
So for them to be able to, I just wanted to get this information. It says the National Alliance of Mental Health, NAMI CC, for resources, information, and culturally sensitive non-clinical crisis counselors for African Americans by African Americans. That's important. Again, did you hear what I said? for African Americans by African Americans. And the number is 925-465-3864. Or you can email calhopeconnect.org. Thank you, sir.
So the big schism with because public health deals with health from a perspective of populations, while medicine deals with health from the individual, and we can no longer do that. They need to always have been together because, but again, now we come to the example of this
Why do
young
we think
African
it's supposed to be
American,
separate? I don't understand.
the money and resources. And so, for example, we have an African American male that commits suicide. He may have been seen by his PCP. Rushes him to the hospital, and he dies. And an example of this is the clinical medicine aspect of the individual being addressed. But what we'd like to do is um, examine it from a public health approach and see and ask how and why did he kill himself. Example, did he have an appointment with a PCP or never had an appointment with a PCP? Because at that appointment, he should have been screened for depression. If he doesn't get seen, though, he can't get screened again. And
I have a question.
Sure.
So, as many young folks or individuals with the guns, we talked about the guns earlier. So with that,
we don't know whether he used the gun.
No. I'm not saying him.
Okay.
I'm definitely not saying that.
Right.
I'm just saying in general, the guns.
Okay.
It to be able to take someone's life. If someone is that a form? There's something going on up there. What's happening in society that is so easy for us?
The Second Amendment.
The
Second Amendment.
Okay. No, I'm saying mentally. Why?
Second Amendment.
A right to bear arms. Okay, a right to bear arms. Really?
Yeah.
But
I'm just saying.
There's some. I'm saying something in your psyche. Hold on, something in your psyche. Something is going on. So what I'm saying to our community, we're pleading with you. What's happening? We need to understand there's something happening with us. If it's easy for us to take another person's life, something we have to do something. And we're talking about prevention. How do the health department help us with this? A public issue, a public cry,
I was thinking
a crisis
about if you never learned how to walk, then how can you run?
That there is true.
Okay. If you are never valued, then the importance of carrying a gun as protection and safety is very important to you in the community that you live in. And if you're not taught that the community, back to public health, is a safe environment, is a site which promotes healthy eating, lifestyle, does not want a preponderance of guns in it, then you have a chance to make but we're not hearing that message.
Right.
So the young men that are taking up arms do so with the idea that it's the American way.
Oh, my. Well, you have tuned in to Believe Radio, which is a 24-hour inspirational and music station. Thank you for tuning in with us. Tell a friend to tune in, co-workers, family members. We want this information from Believe Radio and the shows that we have to get out across our communities around the world. Again, please like, check what is it? Click, comment on Believe Radio. Go to it. Allow it to be your inspirational music station. Thank you, Mr. Pearson.
But again, in public health, there's three core functions: to monitor the health status and identify the community health problems, diagnose and investigate health problems and health hazards in the community, inform, educate, and empower people about health issues. My original assertion is public health public. Or does society feel we should be happy just to have the service that, and is even if it's not even a good service? So that is my contention. That's my bone of contention right now, that public health is not public, and that the public health that we're getting is not worth what we've been paying for.
There's holes in it. In the bag.
Like a Swiss cheese, right?
Yeah.
And so I would say you layer this. And this is a perfect world, right? I mean, we're talking about a perfect world, but we are not in a perfect world.
Mhm.
And as we always have talked, COVID laid to bear the inequities in the public health care system, mental and physical.
Mhm.
And I think it's important that you understand that I think this is a discussion around COVID and the great resignations, good and bad. But we have to also discuss structural and institutional racism and the
Absolutely.
effect that it could on the care and quality, not seen as a problem. I was also reviewing a TED Talk, love TED Talks. Um, I submit to you folks to go educate yourself. Just don't listen to
That's
what I'm saying.
education is the best
Yeah,
medicine.
but
Absolutely.
put it in search, see the
Don't
information,
be on Facebook just
you
watching
know,
all kinds of other crazy stuff.
have
But
a
not say
discussion.
crazy stuff, but
Well, I mean, yeah, because a lot
things
of it
to
is
educate
really, really,
yourself too.
really not really good,
Yeah.
and it should be,
And you can be on there for hours.
media
Educate yourself.
screening, being sure the content and
Oh
quality of
yeah.
what you're absorbing and putting in your brain space is going to help you and not harm you, or not have you thinking bizarre.
Right.
Okay, all right. I heard it on the internet. I saw the YouTube, Doctor Google.
Right.
Come on. Uh, and again, this is laid in a perfect world. And some of the ways they're rethinking public as an urban solution was Leo Wynn. She's a physician, and she said, like so many, not just African American men, but men, this young African American who took a life, we did not hear him. We did not hear his call.
Yeah.
We did not feel he valued. He didn't feel he was valued. Why is all that? Public health should be answering and asking that question. But if you don't think you were important, you don't think you were valued, it's not a question that you
Well, we still
study.
go back to it's considering us as what 3/5 of a human
Human
being.
being.
So people are not correlating that information to how they're what's happening to
What
us
they're
today. They don't
saying,
think we're important.
what they're saying,
That's why
what
NAMI
they're
CC,
saying
the
is
Uplift African
advanced
American
race
program,
theory. This is a
is
discussion around
important.
advanced race theory because
And a
advanced
health
race
web
theory says
hub.
that we should not understand the facts in the genesis of the society, country, and the true historical issues. Example: the first 10 presidents were slave owners. Plain and simple.
It is what it is. You can't fight history.
Example: 365 years, maybe even more, that we provided free labor and we were the backbone for the American economic machine. Well, easy. If you're having someone work for free, I'm sure you can do better. And you take everything. Now you take everything from them. You take everything from their children, 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 and leave them with nothing.
Mm.
So that is the mental health schism. That is the health schism. Because if you're 3/5 of a human being, you're not as even good as the horses.
Oh my
You know.
goodness. Once again, you have tuned into Believe Radio, which is a 24-hour inspirational and gospel music station. Please allow us to be your inspiration. Tune
So
in, definitely.
so we accept, what's a public health issue now? Well, poverty is a public health issue.
Absolutely.
Racism is a public health issue. Classism, sexism is a public health issue. And the fact that that's not accepted as that common knowledge that says that you are devaluing a group of people that it's affecting. Uh, I think the working model for our health, well, we're not even doing a good job. African Americans are number one in heart disease, number one in cancer. Our
Goodness.
poor communities related to mental health, 25% incarcerated, 25% homeless. And
And
if
this
you're
is
in
real.
LA,
We're not just making this up.
if
So,
you're in LA and you are that person with a mental health issue and a substance issue, you're more likely to die.
goodness.
Now, here's the discussion I say that all those personnel that 1 to 25 that have to be involved in those deaths, a impact on the system and the cause. Wouldn't it be better to treat them at the source? Wouldn't it be better to address these issues on a public health issue? I
Absolutely.
think so, but
Yeah.
that's me.
And you've been practicing for how many
yeah,
years?
yeah,
35.
yeah.
So I think
Uh,
you know a little something.
yeah, and they're saying that so this discussion gets back. This is the young lady, Dr. Lisa Rankin, and she led a TED talk about the number one public health issue that she felt. And we are tribal people.
Mhm.
We work by groups. We work in function. We don't work in silos. And the discussion is lonely,
Yeah.
the loneliness.
Mm.
And they show that people that are lonely don't have a circle of at least 10 people to interface, interact, or good people to interact with, are more risk for heart disease, more risk for cancer, more risk for hypertension, infection, anxiety, and depression. 1 in 5 Americans are lonely, feeling separate from other. They dissociate from the family of humankind, and you have to ask yourself, where's the love?
Yeah.
What love are we doing? And this is something I want to share with folks. And I've been sharing it for a while, but I think it's really, really important. Again, this is from one of the books I'm reading, OG, The God Memorandum. When you were working in corporate America 20 or 30 years, you didn't get an email or text, you got a memorandum. And so the memorandum sticks out. We want to do solutions is to count your blessings. Again, this is OG Mendingo. You can go read about, he's a slew of books, best-selling author, was an alcoholic at one time and felt almost that he was going to end his life. But he said he was still too much of a coward. And so that young man wasn't, though.
Yeah. And then, so while you're going there, I do want to say that at NAMI CC, there is a young adult support group. And it says, join the African American Young Led Support Group. We provide emotional support and opportunities to share your story, advice on school, work, mental health, religion, and etc. Coping skills discussions, and a space to build relationships, connections for young adults ages 18 to 32. Through the group is catered to the focus on African American communities. All are welcome to join. So please contact them. And the young lady is Naomi Gasher. And the telephone number is 925 excuse me, 925 765 9268.
Okay.
925 765 9268. And they meet every fourth Monday of the month from 7 p.m. to 8 p.m.
Last
So
thing,
please,
we're going to define mental health. We're almost at our shit in the show.
Yeah.
Mental health is defining. Mental health is not just mental health. It's defining and coping with stress, maintaining meaningful, healthy relationship, and living through life.
Naomi Gashaw.
Okay, Ms.
Let me get it right.
We know that stigma plays a role. 22% did not receive aren't seeing mental health because of stigma, and it's reflective in culture and race examples. And again, an example I give is 86% of the providers are white, 5% are black, and then there's an indigenous group. The last thing I want to share is that,
time flies when you're having fun.
You want to count your blessings, proclaim your rarity, go the extra mile. You have choice and do all things in love. One thing I didn't mention throughout this, the discussions around loving yourself, loving the family, looking to the family for support. Those people that have family and interaction connection are less likely to commit suicide or make a call to help before they do it. Again, the suicide number that I have here, and this is Suicide Benefit CDC, is 800-273-8255. That's the hotline number, 800-273-8255. Miss Howard, we've come to the end of our show almost.
I know, my God.
I want to thank you folks for tuning in.
Awesome that
we're not done, but
we're not done.
We're not done yet.
We're not done yet.
So I want to thank everyone for tuning in, and I want to. I'm going to give the end of the show out to Ms. Howard.
I do want to give the information for the warm line for NAMI CC. It is 925-465-3864. 925-465-3864. Time flies when we're having fun. Community, we want to thank you for tuning in to Believe Radio, which is a 24-hour inspirational and gospel music station. Today, you were listening to the Medicine Hour with Mr.George Pearson and Barbara Howard, aka
and
Sister
I think we got a graduation
to
go to.
Oh, not
this young lady is graduating.
Next week.
Here we
I have
go
two
again.
graduations. I had three.
Here we go.
All right, but we want to say
educated black folks, get on home.
We want to say thank you and good night.
Good night.